COVID-19 can be characterized as a pandemic.
COVID-19 set all kinds of records in the U.S. this week, and none was good.
In El Paso, that's one of the state's hardest hit areas.
When I think back about the pandemic and how UMC and the whole district performed, I'm not insincere when I say that it was really absolutely amazing and commendable what everybody did.
When it was declared a pandemic, I'll never forget that day. I was actually in a meeting. I remember looking at the WHO website, the CDC website, and it was declared a pandemic based on all the cases that we had seen in different continents. At that time, we knew that everything that we had been planning for had to be implemented. As the pandemic evolved, we understood just how infectious it was. So we wanted to make absolutely sure that we had everything in place to best try to reduce the patients and our staff to get infected.
You know, I think my biggest priority, of course, was the workforce, the safety of the workforce. So one of the first things we did is move many staff as we could to work remotely. And IT did a lot of heavy lifting to make that happen. And we were able to move several hundred of people. And then after that is how do we keep our workforce safe that is coming into the hospital every day.
So I was tasked to look at different processes, right? Amongst those processes was the creation of a tracking system for COVID positive patients. We needed to find a quick way for our associates to know who was positive and who was negative.
There was that challenge that was really exacerbated by the fact that El Paso was the peak of COVID patients in the nation at that time. And so a lot of credit goes to the HR team as well as occupational health.
El Paso hospitals have never been busier during the pandemic. UMC's Dr. Jose Burgos tells me he's surprised at how quickly things have taken a turn for the worst.
I never saw myself as a hero, but I did see the nurses as heroes, and the techs, the RTs, the environmental services people, they were really my heroes. So it was a superhuman effort that what they actually had to go through in order to take care of patients during that time.
I am so proud to be working at UMC, and I am so proud of our engineering team. When they came up with the idea to make all of the rooms in the hospital a negative airflow, that was a game changer. So we were able to maintain the virus in the room and not contaminate any of our areas. That was one of the best things that we did, and I think that saved a lot of lives, and I think that saved a lot of us from getting infected.
Materials management, just being able to make sure that he managed, the PPE orders in a way that allowed us to have enough for our staff. Yvonne in her, re-sterilization process of the masks, along with Amy and the whole team. That was really incredible work.
So at that time, it was fast and furious. Every single day was like living 10 days in one. We had to coordinate our teams to be able to deliver a quick response, provide the support to our team here with other resources, making sure that they had what they needed and that they felt supported. That was the most satisfying part.
So during the pandemic, I helped to really gather our nursing workforce, make sure that our nurses at the bedside really had the resources that they needed to be able to take care of our patients, and bringing in resources as other nurses, but also how we could become more efficient in making sure that we had the PPE that nurses needed. Not just nurses, but also all personnel, our doctors, our respiratory therapists. So making sure that we had teams developed so that we were looking at innovative ways to really figure out how we can best tackle this with leading the team and making sure that we had what we needed to take care of the patients that were presenting to us.
My role at UMC during the pandemic was I was the administrative director for medical staff and risk management, and my primary role was to onboard volunteer providers from the state. We worked with many federal agencies. I would get calls at all hours of the day. I could count on my team. They helped onboard a number of providers, so I'm very proud of that and the commitment that we had to the organization.
I think the partnerships with El Paso Children's, El Paso Health, and also with Texas Tech, everybody was working together, and it was such a big initiative for all of us to come together as an organization. Also, the vaccination project, I think, was huge. We were out of the gate before anybody else, thanks to Myron and his team, and really to, again, have the whole leadership team evaluating the best way that we could roll out the vaccines to maximize the number of people in the community.
We're really proud to be able to not only offer this vaccine to our frontline providers here, our healthcare heroes, which they truly are.
First person in the city of El Paso to receive the COVID-19 vaccine.
It was really a blessing. It was a blessing. It was something that, we had hope for, because we knew as soon as we got it, we could turn around and begin to vaccinate the whole community. And El Paso Children's was really a critical piece in us being able to vaccinate the community. They provided many nurses to help us staff, so we absolutely could not have done the number of vaccinations that we did without their support.
A person that did not get a vaccine back then could potentially lose their life. I mean, that's what we all saw. The fact that we were able to support that process, and we were able to at least, raise flags, because so many people wanted to go to the Coliseum. That proactive work helped ease the situation, and at the end we were successful in providing the vaccinations to the community.
This recognition is really about all of the associates that were with us from day one during the pandemic and that are still with us today. I don't care what position you were in. I know that there was a level of fear and concern, even if not for yourself, for your family members. So to each and every one of those associates, I would say thank you. Thank you for being there when we needed you, and for your work, for your dedication. We couldn't have done it without you, and so you're such a part of this recognition, so that we can just offer a small thanks to you for everything that you did.